We who work in breastfeeding focus on the early days. Some have expressed the opinion that we grow out of tongue tie. But in fact, a severe tongue tie can affect us throughout life. This is a special feature on adult sequelae of tongue tie. Parents often ask me whether they have a tongue tie when they have a tongue-tied baby. I do perform adult frenotomies, usually fathers. One had never been able to speak clearly. He had a frenotomy, and it happened that his mother called later that day, unaware of this, and said, "Hey, you're not mumbling like you usually do." She was amazed to hear what had happened. Another had a sore tongue from public speaking, and yet another developed a small sore growth on his frenulum from rubbing between the two lower incisors. This father's baby daughter has just had a frenotomy for posterior tongue tie. He has difficulties with articulation and avoids public speaking. He wore a retainer for some years for a narrow dental arch. For adults, I spray generously with Xylanor, lidocaine 15% dental spray. Excellent, good. Can you stick out? Yeah.
Yeah, I thought it'd be worse.
Yeah. Can you lift it up? Up. Up outside your mouth or no? Yes.
Or I would stumble over words or stumble through them, or have to repeat the word.
Yes.
And a lot of slurring. Yeah, definitely I noticed, looking back, that it did affect my speech.
Yes.
So,
okay.
so I would avoid public speaking. I dreaded it, so.
Did you?
I think everybody does, but it
Yes.
was always
We
that
do.
thing in the back of my mind that I was going to stumble through a speech.
Yes.
Yeah,
Yes.
mess up a word here and there.
Oh,
So,
did
but
people often have to ask you what you'd said?
a lot of times, yeah, people had to get me to repeat myself.
Right.
It was good. It was a couple days of soreness, but other than that, it healed right up. I'm a little more aware of that I did have a problem before, so now I'm making more of an effort, and it seems a lot easier.
Yes.
I'm not tripping over words.
Yeah. Now I would like to show you parts of an outstanding video by our colleague Dr. Greg Notestein, DDS, a dentist in Ohio, with his kind permission. Dr. Notestein is very well known as a dentist and also for his passion for tongue-tie treatment in breastfeeding babies and in adults. His patient Linda is an IBCLC and a very well-known lecturer and educator in breastfeeding. She is very proud of her grandson, who is also tongue-tied. Here is her amazing life history. Linda was unable to breastfeed as a baby, though her mother tried. She developed a big overbite and wore braces for 4 years. She has a high palate. She has suffered from TMJ and wears a bite guard. In 2003, she was diagnosed with sleep apnea. She now uses a CPAP machine and has much less daytime somnolence. She has been a very loud snorer since youth. She has a receding chin, and she struggles to speak clearly at the end of a day of lectures. Had Linda had this procedure done in infancy or childhood, she would have avoided many problems. Sometime after the procedure, Linda told me that it had changed her life to be able to speak well for long periods with no oral fatigue. Tongue tie can have lifelong effects. Thorough oral evaluation should be done on all babies. The risk-benefit ratio for the simple and safe procedure in frenotomy is impressive. Early frenotomy is highly recommended to prevent articulation, dental and social problems.